Hi, everybody. Welcome to the February webinar. We have another guest. Margo has been with us at least the last 2 years and has worked with a lot of clients to help them secure supplemental coverage that works with Medicare and retirement. And she's here joining us again. So we're very grateful to have her. And what we're going to do is Margo's going to go through a presentation, and then towards the end, she'll take questions. You can ask questions along the way as well by clicking in the Q&A box at the bottom of your screen and just typing in your question. And Margo, you generally will address those at the end or as you go.
If I notice them, then I like to address it as we go.
Sure.
If it's applicable and won't take me, too far off on a tangent. And then I'll also address them at the end as well.
Perfect. I know we probably have some anxious clients with everything going on in terms of what's happening with federal benefits, Medicare. And so hopefully you can speak a little bit to that as well. But I'll go ahead and turn it over to you and we'll get started.
Awesome. Thank you so much, Josh. And it's been a pleasure working with your clients. I actually had one reach out yesterday. She watched the webinar from last year. So it's been a fun time working with your clients. So I appreciate the time today. A little bit about myself. I am Margo Steinlage, co-owner of Steinlage Insurance Agency. We have offices in the Midwest, and then I have about 4 offices here in Virginia, but we service clients all over the country. So if you are located in Virginia and you move to Florida or out west, our team and our services follow regardless of where you actually end up after retirement. All of our services are free, not just because you are a 4J Wealth client, but we are independent brokers. So my team is all salaried. They could care less if you move into Medicare at 65. And sometimes it may not be the right move for you. We are looking at your entire picture from a holistic vantage point and trying to advise on what's best for you, what's best for your family. Do you have younger children? Do you have younger children on the plan that need to be accounted for? And really provide this high-level health insurance advice for the entire family, not just for the individual who is moving into Medicare. So if you need ACA coverage, if you are an early retiree or have a spouse who may be getting kicked off the group plan when you decide to retire, we can assist in that space, navigating the ACA and COBRA in addition to Medicare. Again, it's free services. We go get appointed with all of the national carriers on the Medicare product, and we are appointed with all of the carriers on the ACA product. So whether you're in Virginia, Maryland, DC, we can assist in selecting ACA product as well. Also, we're very proactive in our white glove services with prescription reviews each year. And long story short here is a review is critical once you move into Medicare, especially with this turbulence with the Inflation Reduction Act. There's a lot of changes coming down the pipeline with Medicare. This is never a set it and forget it space. So our proactive review in the fall is I can't highlight its importance because again, there is no set it and forget it mentality once you do move into Medicare. So today I'm going to jump into who is eligible for Medicare. What are those unique rules for moving into Medicare? What's required? Then we're going to dissect what is Medicare. What are these different moving parts and plan options that are available to most of you? And then lastly, we're going to look at that Inflation Reduction Act and how does this affect your coverage for 2025 and beyond, and also look at IRMA. Many of you are high earners right now and perhaps even into retirement. How does that affect your Medicare premiums? What is IRMA? Okay, so if you have any questions, like Josh said, go ahead and chat them, and I'll try to answer them as we move along the presentation. And if I don't, then we'll go ahead and tackle those at the end. Also, feel free at any point to reach out to Josh. He can forward your questions to me, or you can reach out to me directly. We have a pretty open relationship here. So who is eligible for Medicare? Typically, as you approach your 65th birth month, you have this unique window to sign up for Medicare. And the general rule is that you need to sign up for Medicare upon turning 65 to avoid any lifelong penalties or gaps in your current health insurance. So that's the general rule, that you have to sign up for Medicare at 65. The exception to this rule is if you or your spouse are working with a large employer, then Medicare can be optional at 65, meaning you don't have to sign up for Medicare. You have this choice: do I move to Medicare, or do I stay on my large group health plan because it may or may not be a better fit for you in the future. So what makes a employer a large employer? What we are looking for is an employer, you or your spouse's employer. If it has 20 or more full or part-time employees, then it's deemed a large employer under Medicare rules. And if there's 20 or more full or part-time employees, then Medicare is optional. You don't have to sign up at 65, and you won't see gaps or penalties for delaying Medicare enrollment at 65. If you're on COBRA at 65, you need to move into Medicare because COBRA is not active large group coverage. You're not actively employed with a large employer at that point. So anytime there's COBRA that's coming into the equation, you need to be aware that you could fumble through this Medicare enrollment if you're not kind of working with an advisor to make sure that you're not running afoul of any regulations. So here, if you or your spouse have that access and enrollment on large employer coverage, then you have a decision to make. Is Medicare advantageous, or do you want to stay on that large group health plan? And one of the reasons why somebody would stay on the large group health plan, one of many reasons, is that, hey, I can max out my HSA and get these tax benefits by maxing out my HSA. If you have a large group health plan and you wish to stay on that large group health plan, and you have access to an HSA, it's an HSA qualified health plan, you need to be conscious that you have to delay both A and B enrollment in Medicare to be able to contribute into the HSA once you turn 65. Because if you pick up that free Part A hospital benefit and let it hang out as a secondary payer, Medicare and IRS do not allow you to have any part of Medicare and contribute into the HSA. So one of the things we do with 4J Wealth clients is just help you create your timeline. If moving into Medicare makes sense at 65 because either you have to, you're on a small group employers plan, fewer than 20 employees, Medicare is required. If you're on a large group health plan, what are the pros and cons to staying on that group health plan versus moving to Medicare? If you plan to stay on the group health plan, let's create your HSA timeline and make sure that we can still continue to max out the HSA without, running afoul of IRS regulations. Okay. Also, something that should be on your radar if you're in the camp of delaying Medicare, you're staying on that large group plan, you do have the HSA access, and you're contributing and you're maxing out your HSA. Let's say you wish to retire 3 years down the road at age 68. As soon as we submit your Medicare paperwork to create this special enrollment window after age 65 and come off that large group plan, your HSA has to be timed according to your Part A effective date. So as soon as we submit your paperwork, let's say we're submitting it in October for a January 1 transition, you're retiring at age 68 as of January 1st. As soon as we submit that October paperwork for the January 1 transition, Medicare is going to retroactively apply your Part A benefit. I'm in the weeds here, but we see this happen time after time where you over contribute into your HSA the year you file your Medicare paperwork when it's after age 65. So we want to time that retroactive 6-month Part A benefit, your Medicare paperwork, and the HSA contributions given that year. So again, I always recommend kind of starting this consultation practice about 6 to 12 months out from your 65th birthday. And if you are in the camp of being able to delay Medicare at 65 and stay on that group plan, and you're kind of playing with retirement in the near future, I would say the 6 to 9 month window is kind of the sweet spot to reconnect with us and say, hey, Margo, hey, Team Steinlage, I'm ready to retire on X date. What steps do I need to take to make that transition from my group plan into Medicare happen? And that's where our team comes in. Josh, you can attest to this. We hold your hand through that whole process, whether you have to take Medicare at 65 because you're on ACA, you're on COBRA, you're uninsured, or you're on a small group health plan, you have to move into Medicare at 65. If you're on the large plan with a large employer, then it's optional. Okay. Some other factors that come into play is if you have a younger spouse or children on that group health plan, whether it's a small or large employer plan. You know, what happens to them when you make these decisions? How does COBRA come into play? How does ACA come into play for those younger family members once they get kicked off your group plan when you're ready to retire or you're making the move into Medicare? We can assist with that consultation as well. And that's kind of part of our big picture advice that we'll provide you with.
Margo, I have a quick question.
Mhm.
So let's say you sign up for Medicare on your birth month. So I know you want to do it generally earlier, but let's just say turn 65 in May, I actually apply in May. It takes those 90 days to process.
No. So there's always unique enrollment periods within Medicare. So if you're enrolling in Medicare 3 months before your 65th birth month, then Medicare would take effect in your example on May 1st. If you're turning 65 in May and you sign up in May, then June 1st would be your Part B effective date. If you sign up in the 3 months after your birth month, in this example, if you sign up in June, you're getting a July 1 effective date. If you sign up in July, you're getting an August 1 effective date. If you
Got
sign
it.
up in
would-
August, you're getting a September 1
So
effective
I would
date.
need to make sure I had coverage through the end of May before Medicare kicked in to avoid a gap.
Correct.
Okay, thank you.
Yeah, there's always unique timelines, whether you're new to Medicare at 65. The 3-month window comes into play when you are delaying Medicare at 65, and now at 68, you want to retire. We can submit your Medicare request and paperwork to trigger that special election window, enrollment window, 3 months or 90 days out from your desired transition date, no earlier. So we always like to plan 6 months out, and now on that 90-day window, we're already like, we have our game plan, our timeline created, and we're reaching out on the 90th day saying, hey, let's start this process this week. Here's the next steps to get that kind of wheel cranked for Medicare to happen in 90 days. It's job security. There's so many election codes and enrollment windows. It's a lot to juggle, but this is why we are very popular. So, okay, so again, that general rule, you got to do something at 65 if you don't have access to the large group coverage. And if you do have access to the large group coverage, then you have some options. Medicare is optional. Okay, so I know I'm throwing out Part A, free benefit, Part B. These may be new terms to you if this is like your first new to Medicare intro education piece that you've watched. So in a nutshell, when you turn 65 or when you come off that large group plan, you have to enroll in Medicare. Original Medicare consists of 2 moving parts. You have your Part A hospital benefit and your Part B medical benefit. This will be shown on your singular red, white, and blue card, Medicare Part A, Medicare Part B. Everybody will pay a standard Part B medical premium that's set by Medicare each year. The standard rate for 2025 is $185 per month. For the for the Part A hospital benefit, generally this premium is 0 per month. If you or your spouse have a combined work history of 40 quarters, you paid into the system. Now you each can reap that Part A hospital benefit at no cost to you. So the standard Part B premium is the $185. That is set based on your income. So if you are a high earning individual, you'll see the $185 per month increase. If you are low income, you are qualifying for Medicaid, state assistance, you'll see that Medicare Part B $185 per month per person premium adjust and basically get washed. Medicaid will pay that for you if you are qualifying for Medicaid. Where we see most clients fall, especially working with kind of higher net worth clientele, we see many clients experience that income surcharge, also known as IRMA, income related monthly adjusted amount. So many of you will say, hey, I want to move to Medicare. It's $185. It's cheaper than my large group health plan. That may not be true. You may see a much higher income surcharge tacked onto that monthly premium, putting you in the $400 or $500 or $600 per month premium range rather than this $185 per month premium. So again, I can get in the weeds now, but this IRMA, this income surcharge, is a very important factor that we consider when we help you make decisions of timing your Medicare transition. I'll jump into the IRMA in further detail towards the end of the presentation. But just remember, put that on your radar that, hey, Medicare's not free. I have to pay the standard Part B premium to get into Medicare when I desire to, and it may actually be much more expensive because of my earnings. So when you are saying, hey, Margo, hey, Team Steinlage, I'm ready to move into Medicare. I'm coming off my group plan, or I have to at 65. We're helping you enroll in Medicare Part A and Part B. You get your red, white, and blue card. And if that's all you do, and you walk in the hospital or the doctor's office with your red, white, and blue card, what do you have? What benefits does just original Medicare give you? Well, you can access any doctor or provider nationwide that accepts original Medicare. And about 97% of doctors and providers accept original Medicare. If you go in the hospital, you're responsible for the first roughly $1,600 per 60-day hospital occurrence. If you go in for an MRI, you need outpatient surgery or in ambulance or ER or blood work, you're responsible for the Part B annual deductible, which is much smaller. It's $257 per year. Once you satisfy that annual deductible, then Medicare will cover 80% of the bill. Again, this is just big picture. You are responsible for the remaining 20% gap that Medicare does not pick up. So your largest exposure here under original Medicare is that 20% coinsurance, your $1,600 60-day occurrences, and you'll see here, this does not even touch drug coverage. It doesn't touch dental, vision. So these gaps that original Medicare leaves on the table is where all of these ancillary products like Medicare Supplement, also known as Medigap, Plan G, Plan N, your Medicare Advantage Part C product, your Medicare Part D drug plan options, dental plans, vision plans, these all are available to you to fill your gaps that original Medicare leaves on the table. Because without these ancillary products, you have quite a large exposure if you just walk around with only a red, white, and blue card. So how do we fill these gaps in original Medicare? Really, there's two pathways to select from. There's a third option if you are a federal retiree. My office does not handle the federal retiree planning. There's options where you can select a fee for service consultation. I think, Josh, I've shared with you my contact for federal retiree consulting. This webinar
Is it Tammy Flanagan? Is that
is
who?
Tammy, yes. So there's not a lot of people who do the federal retiree consulting. So Tammy is a great resource that I've referred hundreds of clients to. But this webinar really is geared for the private individual or government contractor who doesn't have access to the federal retiree benefit. So here, as a private worker or government contractor, you have access to really two different pathways of filling the gaps in original Medicare. Maybe a third pathway if your employer is offering a retiree plan. We can consider the different pathways in addition to that retiree option to help you make the wisest decision based on these different options at play. Most people will tend to go that Medicare supplement pathway in this area. On average, about 50% of the population will go supplemental, 50% will go advantage plan, and I'll kind of dive into the nuances of these different selections and options. But from working with wealth managers and financial advisors, generally those that are coming to us from our financial advisors tend to lean heavy in favor of these Medicare supplement plans for more flexibility. There's no wrong or right answer here. You'll talk to 6 different people and you'll have 6 different options that they've all selected from. One neighbor is a high net worth individual, the next neighbor is lower income, and they choose the zero premium pathway. So again, each of you will select and we will make recommendations based on your very unique circumstances, financial, health needs, family dynamic, etc. One thing to note is that no matter which pathway you choose to end up filling your gaps in original Medicare, you are always responsible for that Part B medical deduct or medical monthly premium, the $185 per month, plus any IRMA if we can't appeal the IRMA, the income surcharge. Okay, that's a standard cost regardless of your plan selection here. So let's say you are somebody that says, hey, Margo, hey, Team Steinlage, I really want flexible coverage. I want access to any provider nationwide. I don't want pre-authorization or a third party managing my care. Well, I'm likely recommending this Medicare plus supplement and drug plan combination. When you go this pathway of coverage, you can go to any provider that takes original Medicare. Medicare remains your primary payer. If you go in the hospital, you're in Mayo Clinic. Mayo Clinic is billing Medicare. Medicare is paying its 80% more or less. And now the residual claim will flow to your Medicare supplement, also known as Medigap plan that you have on file. So whether it's United Healthcare, it's AARP, it's Anthem, it's Aetna, it's Cigna, it's Mutual, there's a ton of carriers that offer supplemental. It doesn't matter who you ultimately choose to obtain supplemental coverage through, they are required to pay as long as you are going to a Medicare provider and getting a Medicare approved service. So again, that provider bills Medicare, submits the claim, and then Medicare submits the residual claim to whoever you have on supplement or on file with your supplement. It's a very streamlined process. You don't get these bills and copays and coinsurance that stack up to $3,000 or $4,000 each year. You'll get a summary of notice from Medicare that says, we paid this, your supplement paid this, you don't owe anything. So how these supplements are set up, they are all standardized by the states. So if you're in Maryland or DC or Virginia or Florida, and you have this supplement plan G, it is identical regardless of the state that you reside in. Here, if you go in the hospital with Medicare and a supplement plan G, your only exposure is the $257 annual deductible that Medicare has each year. So if you're, I always say, hit by the bus, if you are very sick, you have a high service year where you're in and out of the hospital, your only exposure is that $257 per year medical deductible. It's not per service, it's per year. Then Medicare and your supplement G will pay 100%. So I will say this is the most popular supplement that you can get right now. It's the best Cadillac coverage that is available to somebody who says, I want the best coverage for 2025. And it has been for the last, I would say, 10 years. The 8 years. The next best option under this Medicare plus supplement combination is a supplement plan N on the far right side of the screen. And usually the G and the N supplement in most states will range about $30, $20 to $30 difference per month per individual. And if you say, hey, Margo, I don't want to pay for the best coverage, but I'm a little bit more risk, tolerant, I'll take the savings in monthly premium and take on a little bit more risk, then this plan N option is an economical product for you. With the plan N, you have that $257 deductible exposure. And then when you go see any provider, you're paying a $20 copay per provider, and you're paying a $50 ER copay if you ever land in the hospital. If you go to a Medicare provider, but that Medicare provider does not agree to bill per Medicare's reimbursement schedule, then that provider can balance bill you the Part B excess charges. And what that means is most states limit this Part B excess exposure to 15% above what Medicare will typically reimburse. So I like to use an example. If I go to my primary care doctor and they agree to Medicare's reimbursement schedule, which is $100, then they will bill Medicare the $100 and my plan will cover 100%. If they are non-assigned, they do not agree to Medicare's reimbursement schedule, they will bill Medicare $100 and balance bill you 15% above that, $15 in this example. Your supplement N does not cover that balance bill that's happening in the background. That's called a Part B excess charge. So here, if you go N, just be aware that there are some providers, not many, but some providers that do not agree to Medicare's reimbursement schedule and will bill you for the Part B excess exposure. Your supplement G for a few extra dollars a month will protect you from those excess charges for non-assigned Medicare providers. So G and N are going to be the most popular benefits. With that being said, you will also need to add a standalone drug plan. And here we are making recommendations each and every year based on your current most up-to-date list of medications. So as you're approaching your Medicare transition date, we are collecting your most up-to-date drug list. If husband and wife are both moving at the same time, they're likely getting comparable supplements to trigger spousal discounts, but the drug plan selections, there's 20 drug plans available to you all. Those are going to be very specific based on each of your medications. So a husband and wife may have different, or partners may have different drug plans. Then in the fall, once you do move to Medicare, in the fall, we are reviewing that drug coverage to make sure that you are always in the most adequate plan based on market changes and your drug plan changes. If you wanted to add a dental and vision policy here, we would add an ancillary kind of rider, and these usually run about $30 to $50 a month. In the past, I found myself saying, dental's a wash, you don't get much bang for the buck out of it. In the last 18 months, there's been a tremendous increase in the amount of dental annual benefits that these plans are offering, where in the past it was about 15 grand, or excuse me, 1,500 per member per year. Now we're seeing upwards of 3 to 5 grand in most markets being available. So that $30 to $50 price point is becoming more advantageous from a dental plan perspective. So here, this level of coverage is awesome. You know, I wish I had this. It's affordable, especially if you're not getting slapped with the IRMA. And you have total access to the Medicare network, any provider that takes Medicare. You will never ask, do you take my United Healthcare supplement or my Aetna supplement? Remember, the question to always ask is, will you take Medicare? Do you take Medicare? Medicare is my primary. So here we're kind of piecemealing together the best product based on your needs, and we can really cherry pick company products. There's no benefit or discount to stacking all of these products with just one carrier. They're not like home and auto and P&C where they'll bundle. I think it's State Farm bundle and save more. That's not the case under the health insurance combination. So the negative to going this route is, hey, I'm paying a lot. I'm paying monthly premium for my Medicare. I'm paying monthly premium for my supplement. The supplements on average in the past went up like 3 to 7%. Now it's more like 7 to 12% post-COVID. So setting your expectations is one of my jobs. And I have to set your expectation that, hey, your supplement is going to increase on an average of about 7 to 12%. And we need to work with your advisor to make sure that we have savings to accommodate for that premium growth or increase over the next 20 years. Also, something to consider when you move into Medicare. In most states, you have this unique scenario timeline that you can pick up a Medicare supplement product, also known as Medigap. They're interchangeable terms. You can pick up this product without any medical underwriting or any look back at your pre-existing issues. You're guaranteed acceptance. If you kind of kick the ball down the road and you say, oh, I don't want to pay $200 for my supplement, Margo, I'm just going to ride out original Medicare. And now 3 years later, you get hit with a health scare and you say, hey, Margo, I want to pick up that supplement now. I'm going to say, okay, John, you need to go through underwriting, and they're going to do a full assessment of your health risk. So I mentioned this because we have this sweet spot when you do make that move into Medicare, whether it's at 65 or at a later date when you come off the large employer plan. We have this sweet spot to get into the supplement and avoid any health questions and lock you in. If you choose the cheapest, smallest carrier and you say, I'm chasing the cheapest rate, and they jack up your rates 20%, and you say, I want to go from small carrier to medium-sized carrier with better rate stability and pay a little bit more, I'm going to say that's great, but we have to medically underwrite you because now you're outside of this new to Medicare window. We have to medically underwrite you to shop your supplement G to supplement G or supplement G to supplement N. So your initial onboarding into Medicare, whether it's at 65 or later, when you come off the large group plan, your decision is very critical. It has long-term consequences. So again, our goal is to help you navigate this and make wise decisions and the right decisions for the long-term play, not necessarily, year 1 or year 2, I want the cheapest rates. With that being said, Josh, I know you have clients like this. I have clients like that. They say, hey, I'm super healthy. I'll never have a health scare. I'll chase the cheapest rate each year and I'm fine with underwriting. We do that frequently, but my goal is to set the product for the long haul because most of us are not in perfect health. Even if we like to think we are, we have something that will flag us as a high health risk if and when we have to go through underwriting. The drug product, that Part D product that's specific to your current drug list, we can manipulate that each fall without any underwriting. Okay? So this is one pathway. This is that Cadillac, hey, I'm going to pay up front and know that on the back end, my medical and hospital is pretty much taken care of by Medicare and the supplement. The alternative pathway is called Medicare Advantage. This is the Part C combination package. Here, you still have to pay that $185 per month premium plus any IRMA. And as soon as you opt into and enroll in a zero premium PPO or HMO Medicare Advantage plan, you go with the Humana plan or the Care First plan or the UHC product or the Anthem product. Cigna's also in this market, Kaiser. You're signing up for their specific zero premium HMO or PPO. You're still paying Medicare. But as soon as you go with their product, now they are the gatekeeper. They are the primary payer. Kaiser manages your care. United Healthcare is managing your care. You have to play by Humana's rules on their PPO or HMO. Are your doctors in network? Are they out of network? What's your exposure if you go in and out of network? So here, there can be a ton of cost savings if you are healthy and you plan to stay healthy for the next 20 years. The downside to going with these advantage plans is that, hey, I'm at the whim of the plan's design that they reset every year. Are they squeezing the network? Are they expanding the network next year? Are my doctors fed up with the plan, or are they entering the plan? So you can fall victim to losing doctors if they squeeze the network. Another negative is that, hey, I need pre-authorization or prior approval before my surgery or care is authorized. That can just be a frustrating user experience that you do not have on that Medicare and supplement pathway. So a little bit of buyer beware is what our goal is, to educate you on the pitfalls of the advantage, but also, again, 50% of the population will go this route. There are positives. It's affordable. If you are cost sensitive, you get free dental, free vision. The drug plan is built in. You have one card that is kind of your gatekeeper to all of the access to care, which is nice for somebody who is fumbling through their insurance cards. But again, those pre-authorizations and the restrictions and the plan design changes that happen each year can be very frustrating. So zero premium looks great, but there is kind of an ugly underbelly that you need to be aware of. And that is our goal, is to help you make the wisest decision based on, again, your unique circumstances and where you are financially, where you are in a health perspective. If you choose this zero premium pathway, and at 65 or when you come off the large employer plan, it's really easy to manipulate. We can bounce advantage plan to advantage plan, HMO with Humana to PPO with AARP to HMO with Care First. We can move around carrier to carrier in this advantage market each and every year in the fall without underwriting. However, as soon as you move or wish to drop your advantage plan and try to move over to that more robust, flexible coverage with the supplemental and drug plan pathway, you have to answer health questions when you fall outside of your new to Medicare window. So again, that buyer beware, I can get locked into my advantage plan if I become unhealthy, because the supplement will ask and require underwriting, and they can deny me access to the supplement plan if I'm outside of this new to Medicare window. So if you're healthy now and in 5 years you become unhealthy, you have a chronic care need, you're going to get locked into this zero premium advantage plan. And who knows if it's zero premium in 5 years? It could be $100 or $200 a month. And the supplements are, $300 or $400 a month. So we really are at the whim of this advantage plan design being manipulated year after year. And we really saw that this year, this January 1st, 2025, and the last open enrollment period. So many of these advantage plans overpromised benefits in 2023, 2024 to entice and stay super competitive with their enrollment numbers, that we had this whiplash happen in 2025 with the product designs. Companies went from $3,000 of free dental to zero. They all added medical deductibles. Networks got slim, formularies got slim. So there was a squeeze on the Advantage Plan product and plan design for this year, which made that supplemental product even more attractive. Although, hey, we see the opposite true as well. We saw a lot of supplemental shift and movement from the supplemental over to the Advantage Plan because the supplements kept increasing. You know, across the nation, we saw double-digit increases in 2025, in 2024. So anyone who was kind of on the fence of, hey, I can't afford this any longer, I'm kind of forced into this Medicare Advantage product for 2025. We definitely see that shift also happen, in addition to people trying to get better coverage and drop their Advantage Plan. So we see the dance on both sides of the equation. Again, our goal is day one, let's look at all of these nuances and pitfalls so that you're making the right decision based on the long term. Any questions there? Let me check my, looks like maybe one Q&A here. Okay, anyone with TRICARE, again, that's a military benefit. You're gonna have to work with TRICARE to set up the TRICARE Prime to TRICARE for Life transition. And I think I addressed the Medicare Advantage plans are not advantageous side of that question as well. So this Inflation Reduction Act is a regulation that was recently passed, and it has changed the entire Medicare drug plan market. So regardless if you are choosing drug coverage through your Advantage HMO or PPO plan, which builds in the free drug plan benefit, or you are opting for this Medicare supplement and Part D combination route, regardless of your decision, your drug benefit is capping you at $2,000 as your worst case scenario when you go fill meds at CVS or your, family Preston's. I think Preston's is still in McLean. Your family pharmacy. If your medications are on the plan's formulary, their drug list of drugs being covered for that year, that's what a formulary means. If they're on the drugs formulary, when you go fill them at the pharmacy and you show your insurance card, whatever you are paying in your out-of-pocket exposure is being added to the $2,000 maximum. So if you go fill Eliquis or you go fill Jardiance or Ozempic and you're getting it approved and pre-authorized and covered under your plan, that cost is going towards the $2,000 total out-of-pocket limit for the year. Once you come out of your pocket roughly $2,000 for the year, then your drug plan will cover 100% of your covered medications for the remainder of the year. So this is brand new regulation that took effect on January 1st this year. In the past, there was this archaic plan design called the donut hole, where you could have been exposed to $8,000, $9,000, $10,000 a year in drug cost. There was no cap on your out-of-pocket exposure. So if you're coming into Medicare now, this is from a cap of your drug exposure. Like, this is a great time to move into Medicare if you are on very costly medicines because of this new regulation at play. I hope this sticks. I don't think there's going to be a radical shift to this specific portion of the benefit. Where we could see some increases is this $2,000 cap becomes $2,300, becomes $2,500, becomes $3,000. And again, you are responsible for more of that cost sharing in years to come. But right now it's $2,000 and this is what we have to work with. The same could happen on your group plan. If you're on a group plan, you saw Ozempic being covered. Now group plans are saying, whoa, this is opening us up to so much liability. We are not covering X, Y, and Z drugs for these reasons, weight loss. You're responsible for 100% of the cost. So I think the medication standpoint is one of the most critical components to our consultation is what's your exposure with your current medicines? Are you on expensive cancer drugs, expensive inhalers for COPD? We're looking at all of these little factors that play into your big decision making. Okay, so I know I promised Irma and going a little bit deeper. So when you move into Medicare, the year you move in, whether you're turning 65 in 2025 and you have to move to Medicare, or you're coming off your large group plan in 2025 and you're new to Medicare at that point, Medicare is going to coordinate with IRS and they will see and use what you filed in your household modified AGI on your prior 2-year tax return. So in 2025, when you move into Medicare and IRS will use your 2023 filed modified AGI to set your 2025 IRMA income related monthly adjusted amount, that IRMA surcharge. In 2026, Medicare will automatically coordinate with IRS to use your 2024 modified household AGI to set your 2026 IRMA. 2027 will automatically readjust based on the 2025 filing. So you don't have to petition Medicare to use that updated 2-year information. That's happening automatically. But what Medicare has no idea is if you have qualified for a life event in that past 2 years, so you retired in 2025, then we can appeal and tell Medicare, hey, reconsider. Don't use my prior 2-year tax return from 2023 because I've retired in 2025. Use my anticipated income modified AGI for 2025, not that prior 2-year look back information. So if you have the life event, this is critical. The life event is what is triggering the reconsideration. If you have a home sale, that is not a life event. If you start taking required minimum distributions and it pushes you over the limit, that is not a life event. But if you stop working, there's a death of a high earning spouse, a divorce from a high earning spouse, you reduce your work hours and you no longer have this high modified AGI for the current year, we can immediately tell Medicare, readjust my IRMA and reduce or altogether remove that IRMA and bring me back down to the 185 figure. So here, again, as we're consulting with you as you approach this 65th birthday or you're coming off the large employer plan, we are considering and making recommendations on what steps to take based on your modified AGI. Do you plan to continue working after 65? If yes, are you going to make, $400,000 or $500,000? Well, Medicare is going to run you $600 or $700 a month if you opt into Medicare and come off that large employer plan, because we can't appeal the 2-year look back. But if you're retiring, you plan to retire, we can say, don't use that 2-year look back, reduce my IRMA based on my current year's modified AGI and that anticipated figure. Here, we only need to prove the life event when we're doing a reconsideration or appeal. We only need to prove the life event. Show me a letter from the employer with your last date of work. Show me reduction of work hours. Show me the divorce decree. Okay, we don't need to prove anticipated income. So again, this is part of our consulting service. Is we are asking on our intake form, Josh, you've seen our forms, we're pretty aggressive with the information we request because we want the whole picture. If we're missing IRMA, we can't give you an accurate recommendation, especially if you plan to work, because that surcharge will come into our recommendation. So we're asking, what's your prior 2-year modified AGI figure for the household? What's your full list of medications? What's your current family situation? let us have all that information on our HIPAA protected encrypted form. And now when we set up the phone call with my team, we are analyzing kind of each critical factor to help you make the wisest decision. So once we do recommend moving into Medicare and you've selected your product, you have your red, white, and blue card, your supplement drug, dental card, or your Advantage card, whatever route you'd like to take, we are reviewing that coverage each annual enrollment period in the fall, October 15th through December 7th. If you go Medicare Advantage, if you're on Medicare Advantage right now, there is a one-time change to modify the coverage or drop that coverage and go back to original Medicare. But again, you got to underwrite to the supplement. So there are unique timeframes that we discussed earlier, Josh, that are different than that 3-month window before you turn 65, the month window, and then the 3 months after 65, your 7-month new to Medicare window. So the annual enrollment will come into play for all of you once you do move into Medicare. And then again, that supplemental coverage it's tricky because in most states we have to modify coverage and underwrite the supplemental product if and when you want to change it at a later date. Remember that new to Medicare window will create a guaranteed issue, a guaranteed acceptance into any supplement. But after that window closes after the 6th month, now you have to answer health questions to modify your supplement plan. Also, one thing that we bring to light when we are consulting, if we see there's generally like 20 medications that we see pretty frequently, we will let you know if GoodRx or Mark Cuban Cost Plus Drugs is a cheaper path to filling medications than Medicare. And this is true if you're on group and you plan to stay on group. You know, I have a small group plan for our 25 employees. If you are on group or you're on ACA or you're on Medicare, be a savvy consumer, be a savvy shopper. There are cheaper ways to fill your medicines than running it through your insurance, regardless of how you're getting your insurance. GoodRx is great. Mark Cuban Cost Plus Drugs has tremendous savings. There's Canadian pharmacies. The more you research your costs on your drugs, the more you're going to realize that it is so decentralized and there's so many players that offer cheaper medicines that fall outside of just traditional insurance. My recommendation is start your insurance planning, especially around Medicare, early. Don't wait. Don't be that person who calls us a week before your 65th birthday to say, hey, I have to have Medicare, because we can control almost every part of this process except for the processing speed of Social Security's office when they handle your Medicare paperwork. That can take 2 days or it can take 20 weeks. We really are at the whim of the competency of the Social Security representative that handles your paperwork. And again, we're doing this day after day. We see nightmare scenarios unfold where Social Security rep fumbles the paperwork, and we see lightning speed on the other side where the Social Security rep processes it in 2 minutes. There's no telling how it'll go for you, but our goal is to stay squeaky, stay on the Social Security office that is handling your paperwork so that we get it processed in a timely manner. Okay, whew. I know it's a lot to digest, especially if this is your first time kind of hearing me speak or hearing a Medicare 101 event. Josh, I think this is recorded, so it'll be shared once it
we'll
goes
send it
to
out
Josh's
to
email.
we'll send it out to everybody, our clients. And it looks like, Margo, there is another question that came through if you want to address that. And then I had a couple kind of questions general that I think might be helpful for people to hear with our couple minutes left.
Yeah. So the last question that came in is about international travel. So Medicare does not cover you, original Medicare, but your supplement and your drug plan, or excuse me, your supplement and your Advantage plan will typically cover emergency coverage. If you're on an Advantage plan, you'll have emergency coverage worldwide. If you're on a supplement, the supplement plans N and G will cover international travel at 80% up to a $50,000 maximum per lifetime per member. So a lot of my clients will get like a short-term travel health specific policy that will fill that gap that the supplement leaves you exposed to. And the supplement is an indemnity product where you have to come out of pocket and then submit and hope for reimbursement. These travel policies are quite a bit different. So if you ever want travel health insurance, not travel protection, but travel health insurance, we can definitely help you. If you shoot, Catherine, if you shoot Josh a email, he can provide Tammy's information.
Yeah. Yeah, absolutely. Does she work with the military, with TRICARE also?
She does not do TRICARE. It's just federal.
I think that Kate's question was about for TRICARE. I thought for TRICARE, basically Medicare Part B is your premium for TRICARE.
It is. Yeah. Typically for TRICARE, you need to sign up for the Part A and Part B to trigger TRICARE for life.
Right.
And now you transition to TRICARE for life.
So just a couple of general questions. I'm just curious as you were going through, like, let's say you got a plan G. So you went with the route where I'm going to pay a high premium, but I basically want things beyond deductibles 100% covered. What would be some of the out-of-pocket expenses that you could still incur even when you go with max coverage plan?
If you go to a non-Medicare approved provider, so Fox Hill in DC is kind of a popular primary care doctor that doesn't take any Medicare. So if you go to that, you're paying out of pocket, you're self-funding. Also, one of the common non-Medicare approved charges, especially in this area, the DMV, there's a lot of proactive health that's going on, as opposed to reactive services. If you do Medicare is very slim on its wellness exam, blood pressure, cholesterol, etc. If you are going to a primary care doctor that's doing like this robust preventative workup every single year, it's not diagnostic in nature. You're just kind of getting your baselines to see where you are. There is no diagnostic reason for that test. Then Medicare will not approve that. You are self-funding that proactive, preventative, robust lab. I don't want to say lab work, because if you go in with a thyroid issue and the doctor says, oh, let's do lab work on this, you're going to be covered. But the preventative exams that are happening at some of these primary care offices, especially in the DMV, are not always covered by Medicare.
Got it.
I'm trying to think of other things that I've seen surface.
Therapy is almost never covered, right? To the extent people want therapy, that's not included.
Physical therapy, yes. If it's like to treat a surgery, or you have some type of issue. Again, if it's diagnostic or linked to a medically necessary reason, it will be covered under Medicare.
How about mental health?
Mental, the hard part with Medicare and mental health is finding a provider who accepts Medicare. Right. 97% of your primary care, your specialists are going to take Medicare. The psychiatrists fall outside of that figure. Yeah, I've read that it's like 50%, but I would say it's probably even less.
In this area, I think it's lower.
Yeah. I mean, hey, and the dentists are the same. Most dentists are like, I don't want to take insurance, or I'm not taking Medicare, because they don't get the reimbursement.
Right.
You see a higher percentage of providers in this area, especially the dentists and the psychiatrists, that are getting the amount they need from an hourly fee, as opposed to needing insurance to reimburse them.
Exactly. So that brings me to my last question. I know we only have a minute left, but let's say you have an HSA balance, right? We encourage people to do that, build it up, save it if they can. That, my understanding is, it can pay for almost anything, but not Medigap supplemental premiums. Is that right?
Correct. exactly. So dental's a great one. Some people use it for like one-off long-term care needs.
Okay.
Your supplement is the only thing that you can't use. It's not a medically qualified expense,
Okay.
correct?
So,
IRMA would be a great use of
yeah,
HSA funds, but dental is kind of the sweet spot.
got it. Okay. Interesting. Those are my questions, and I think people, it seemed like they asked them along the way. So if there's nothing else, I think we can call this a success, and thank you. And you can reach out to Margo or us at 4J, myself or any of the team, to follow up with questions. And we're so appreciative. And just a quick story: we had a client, we had done this seminar, and I had a review with a client, and he was with over 65 and with an employer less than 25 employees, and he wasn't on Medicare because he said he didn't have to be. Margo may remember this was a couple months ago. And I said, that maybe there's some weird exception, but not that I've ever heard of. And sure enough, he looked into it, and it was not in compliance. And Margo was able to kind of unravel that and get him coverage and not face a steep penalty. So not sure exactly how she works her magic, but that was a huge saving for the client. So thank you for that.
Yeah, no problem. I mean, the little nuances come up all the time. So if you're in doubt and you just want somebody to take this and run for you, like reach out to our team. Everybody's very well trained, as you're familiar with most of my team, Josh. I think every single one of my teammates has worked with one of your clients. So
Yeah.
we're here as a resource, a free resource. So use us.
Excellent.
Awesome. Thanks for the time today.
Thank you. Take care, everyone. Bye-bye.